Real Country 1430 AM and 107.3 FM WRDN. I'm Brian Winnekins, and we're joined by Pepin County Health Officer Heidi Stewart today as we talk about some of the things going on with COVID-19. And Heidi, thanks for joining us today. Well, I know because of the Omicron variant, and I guess as the longer we go with this, there's always some new changes and things like that. And we have some new changes from the CDC that you're going to not only talk about, but also for those watching on YouTube, they'll be able to see some of these slides. So tell us about some of these changes.
I'll definitely try to talk through the slides for those that don't have access to those. But yeah, so the last week to 10 days has kind of been a whirlwind of trying to keep up with all the different information, some of the changes. On the 27th, the CDC did come out with a media release. So we kind of knew that something was going to be coming. That media release suggested a shortened isolation and quarantine period for general public and some other populations. And then finally, on Tuesday of this week, that information did come. Basically, what we're being told as to why the changes and why now. Well, yes, we do know we have the Omicron variant now. There is, they continue to follow the science. They do believe that there is a shortened incubation period with this variant. They believe that incubation period for Omicron is between 1 to 4 days, so much quicker than the other variants. And then they also have some information that leads them to believe that there's a shorter infectious period. So where before we were seeing Delta people being infectious up to 2 days prior to the onset of symptoms, now it's looking more like 1 day prior to the onset of symptoms. And the studies of this particular variant are showing that only about 31% of cases will continue to shed the virus after day 5. So that can lead you to another question. Why do this after day 5 with the changes to the guidance if we know that people are potentially still shedding? Well, that 31%, day 5 is, a certain amount of shedding, day 6 is a certain amount of shedding, and that tapers down as we get through to day 10. Some of the answers that we received about that are: 1, the scientific information; 2, the fact that we've been doing this for almost 2 years now, and there's significant impacts on community. They forecasted the surge in cases with how transmissible the Omicron is. It spreads very, very quickly. So they kind of saw that we were going to be having a lot of issues with workforce and school and different things with the way the guidance was. So they lessened that. And then finally, they did mention just plain fatigue and wanting to be able to put forth an option that people could comply with without it significantly disrupting individuals, families, communities. So CDC is showing an effort to, meet us, boots on the ground, and realizing that we're going to have some level of risk in the community. Some level of risk, and we have to be aware of what that risk is and then take precautions, both as a community and individually. So the updated recommendations, and if you haven't heard it or seen anything, here's what it is. For a person who either develops symptoms and then tests positive, or test positive, day 1 would be, or day 0 would be the first day. And then the recommendation is that you isolate yourself day 1, 0, 1, 2, 3, 4, and 5. So day 6, if your symptoms are improving, if you're asymptomatic, don't have any symptoms, and you can wear a well-fitting mask around others in your home and in the public, you can stop the isolation to your home and be out and about in the public. That does not mean traveling. That does not mean going to restaurants, bars, parties. That doesn't mean, I guess what I'm trying to say is that just because that day 6 or day 5 has passed and now you're on day 6, there still has to be some safeguards in place. So that's why the masking is so important. If you, for some reason, can't mask day 6 through day 10, this doesn't apply to you. We would still recommend that you do the full 10 days.
Talking with Pepin County Health Officer Heidi Stewart today. Heidi, with here in the you talked a little bit about the isolation. So how does that work? If I guess for, let's say, okay, a family, I get it. Do I have to stay in my room and I can't even see my family in the house? That's how that works?
Well, that leads us to the quarantine portion of it. So the isolation recommendations are for somebody who has tested positive, right? And if they can separate themselves from others in their household and other people in general, then those close contacts would start their quarantine on that day when they can do a complete separation. So for example, in a household where a mom is the primary caregiver of a 5-year-old child, if that mom cannot completely separate, the mom would do their 5 days of isolation and the child would do the quarantine alongside the mom. And then on day 6, if mom can wear a mask and the 5-year-old child can wear a mask in the household, then that child would begin their first day of their quarantine. And the recommendation would be for that child to quarantine like that, with mom masking through day 10 and child masking starting, through day 5 in the home with the quarantine. And then that quarantine, much like the isolation, can be discontinued starting day 6 if, again, a well-fitting mask and those other stipulations or those other guidance things, avoiding high-risk people, no travel, no restaurants, and then masking can be done, then that child can go about that. Now it's different, and you see here on the screen, groups that are not eligible for a 5-day isolation or a 5-day quarantine would be individuals who can't wear a mask or are unable to wear a mask, such as those under 2 years old. It would be really hard for a 2-year-old to appropriately wear their mask 100% of the time. They're also suggesting for people who have moderate to severe illness with the COVID-19 virus that they do not end their isolation early, that they stick through for the 5 days. And certainly you can reach out to your primary provider and talk to them about if you have a concern about how your symptoms are before making that decision to end your isolation after day 5. And then the immunocompromised. We're working on some graphics that maybe can help explain this. So be watching our Facebook page for more information to come out on this. So I know we talked about quarantine, but again, the CDC guidance around those that are fully vaccinated and up to date, which is some new guidance that they're using, or new language that they're using. If you are up to date on the vaccine, which means you've completed your primary series, and if you're eligible for a booster, you've completed the booster, you do not need to quarantine. At this point, anybody ages 5 through 17 years old who have completed that primary series, which would be 2 doses of the Pfizer, is considered exempt from the quarantine. There may be some of those 16 and 17-year-olds that are eligible for a booster because it's been more than 6 months, but to avoid complete confusion in schools and in families where there's different people on different timelines. The CDC has just come out with a blanket statement saying that if the 5 to 17-year-olds completed their primary series, they do not need to quarantine at this time. And still holding true, if you've had COVID in the last 90 days, or you've had a positive documented test that's documented in the Wisconsin Electronic Disease Surveillance System, you do not need to quarantine.
Talking with Pepin County Health Officer Heidi Stewart this morning or today, and Heidi, where for our case numbers? So where are we at with that? Are we? Yeah.
So the Omicron variant we knew was going to spread really quickly. It's very transmissible, and we're seeing that. Yesterday, the state of Wisconsin hit a all-time high as it relates to the pandemic cases with 10,288. Today, we broke that record with 11,574 cases in the state of Wisconsin today. I pulled numbers for Pepin County. So since December 29th, we have had 89 positive cases reported to the health department, 9 hospitalizations, and 2 deaths. So I think that it holds true what we're hearing as far as the Omicron variant being less likely to cause severe disease. But because the numbers are higher, we're still seeing a significant impact on our healthcare facilities. 97% of the ICU beds in the state of Wisconsin right now are full. There are 464 patients with COVID in ICU beds, and there's 2,002 hospitalizations statewide. So while for the majority of us, the symptoms are going to be mild and we're going to do very, very well with this, that's not the same for everyone. So important to take precautions for those high-risk individuals, certainly.
Talking with Pepin County Health Officer Heidi Stewart today. Vaccine, I know there's been some changes on that too.
Yeah, so we are seeing trends of those who are fully vaccinated having significantly milder symptoms than those who are not vaccinated. I don't have any percentages as far as the number of 89 cases who is vaccinated and who wasn't. But I can tell you that if you are interested in vaccine, we have those at the health department. And now, effective, I believe, either yesterday or this morning, the emails kind of blended together. Anyone ages 12 and older is now eligible to receive the Pfizer booster. So that's a change. We did have 18 and older that could get the booster. They added the 16 and 17-year-olds eligible to receive the booster, and now they've included that 12 to 15-year-old age group. Another change with the booster for Pfizer is that the timeline between the second dose of the primary series and the booster dose, the recommendation used to be 6 months. The recommendation is now 5 months. And they reported to us today that the FDA is reviewing Moderna's request for that time frame too. It would be much easier on all of us at the health department and others who give shots if the time frames were the same for all of them. They're also looking at the information around mixing the different vaccines. So if you received Pfizer as a primary series, you could get Moderna or Pfizer as a booster at 5 months. So a lot of different stuff to follow, a lot of different stuff to be aware of. But the big takeaway related to vaccines is that the Pfizer vaccine is now eligible down to 5 years old, and those 12 and older can get a booster.
Talking with Pepin County Health Officer Heidi Stewart. Finally, Heidi, there's been a lot of talk about testing, at-home testing. or, where can you get tested? We've seen long lines nationwide. And what can you tell us about testing for folks if they want to get their own kits, or is there a place they can go? What can they do if they want to get a test?
Yeah, so I probably sound like a broken record, but I'm gonna give a shout out to Advent Health, Gunderson, St. Elizabeth, and Advent Health here in Durand, Gunderson, St. Elizabeth, and Wabasha. Both of their turnaround times are really, really impressive in my opinion. Advent Health is typically the same day. St. Elizabeth Gunderson is typically within 24 to 48 hours. The Eau Claire facilities also have PCR testing available. So we do know that the PCR test can be more sensitive. It can detect the virus at lower levels. But as you indicated, Brian, there are antigen tests available as well. Those are available at both of the public schools here in Pepin County. They both have test to stay programs up and running where the antigen test can be proctored and then it's entered into our system. And then, of course, there are over-the-counter rapid tests, which are a lot of times the Buy Next Now, which is the same test that's being used at the schools. And those antigen tests, they're not foolproof, and they do have they're not the gold standard like the PCR test, but they do certainly have a role to play as we try to screen out and catch people who are infectious. And studies are showing more and more that a positive antigen test is confirmation that that individual is infectious at that time. If you take that same person and test antigens maybe 5 days later, that line might be a little bit less, kind of similar to a pregnancy test. When the hormone levels are high, the line is really dark. When the hormone levels are lower, the level might be fainter. And that would be the same for like the antigens, where if you're maybe not as infectious as you were a few days earlier, that might be a fainter line.
And a reminder that for Advent Health, please call ahead or have your provider call ahead as well, so that they can schedule a time for you to do that. Well, again, Heidi, we appreciate you joining us today.
Thanks, Brian.
That is Pepin County Health Officer Heidi Stewart. You're listening to Real Country 1430 AM and 107.3 FM WRDN.